Hi and welcome to Schein Chats. I'm Jason Longden, UK Connect Dental Manager for the UK, and sitting alongside me is Dr. Eimear O'Connell, Principal Dentist of Bite Dentistry, also sitting President of ADI, and a keynote speaker at our Digital Innovation Symposium 2020. Welcome, Eimear.
Thank you, Jason.
Today we're going to discuss your journey with digital dentistry.
Yep.
Which I'm very excited to do.
I know.
So can you start by telling us about your journey, how you started?
Yeah, I first of all saw Julian Kaplan speak at the BACD, and I saw his work with CEREC, and I thought, oh wow, that's what I want to be able to do, to deliver to the patients on the day. It was a little harder than that, and I'm not sure I've still reached the levels of Julian, but yeah, I started my journey. I bought a CEREC machine on kind of an instinctive level, thinking I want to make the patient journey easier to access dentistry on the day, and it kind of went from there. But actually then once I got involved with it, it was a wee bit trickier than I thought.
And you say a little wee bit trickier. What was the kind of things, the obstacles that you came across, and how did you overcome them?
So I guess in the beginning, scanning used to have to involve powdering, and there was a technique sensitivity to that. It also involved, the design was a lot harder because the software wasn't as easy to manipulate. And obviously I've seen how things have advanced over that 10 to 12 year period, and it's a lot easier now. It's a lot more intuitive, and you can get much nicer restorations with a lot easier mind involvement or physical involvement from yourself, because the programs do it for you. So it's great.
And if you were to give any initial advice to somebody who's new to digital dentistry, what would that be?
I think try out the scanners, decide what it is that you want to do in your practice. So if you've got a vision that you do want to deliver dentistry on the day without necessarily having to involve the laboratory, then you're going to have to really adopt the CEREC workflow. Yeah. If you're just wanting to use a scanner to minimise the intrusion to the patients by not having to take impressions, then you can just use really lots of different scanners that are available on the market. But I guess the thing is to know what it is you want to be able to do before you make that capital investment.
Yeah, and I think you mentioned in there about the education and personal development side. Yeah. Any advice you would give there?
I mean, I was very heavily motivated to use it, so I actually flew to Phoenix to see CEREC doctors. We used to have a little CEREC study club. I used to pretend it was a Ciroc study club that was dancing rather than talking about dentistry. Yeah, I really invested a lot of time, and I think you know, with anything, if you want to make the best of it, you need to invest in the education. So you need to find out who are the people that are providing the education, the quality of it, and then not just buy it and think it's going to do it by itself, although it is a lot easier now. So, and there's a lot of resources online and things too, so yeah, it's a lot easier.
And how does that, in terms of the whole digital workflow, can you give us a flavour of how that's encompassed in your practice? Yeah,
we have involved very much the team members, and I think that's really a great way of engaging your dental nurses that maybe want to do something just different from being chairside and providing aspiration and doing the notes. It's a really great tool to long-term make them more involved. So my nurses put all the stuff into the machines, they do some of the scanning, they do the CT scanning, they also do a lot of the stain and glazing. So you can easily send your nurses on courses that are run by different companies to show them how to stain and glaze. Wow. And they really get engaged in that, and they love it, and they love them being able to see how it looks in the patient's mouth, because it's their crown or their restoration. Wow. So yeah, it really provides a lot of value for them and for me, and we've tried to let our staff be a little bit profit share so that they understand that they will get some benefit back from this. So I've managed to keep my staff for quite a long time because of that.
So you have a good staff retention?
Great staff retention,
okay,
yeah. There's a way of engaging them in a better and a more fulfilling way, I think, for everybody. Yeah. And obviously if I can give the team a job, it's better if the team do it than me. So
and have
delegation.
Have the team been part of that? They've had the personal development as well? Yeah. Courses, etc.
All the education. Yeah. So they follow me, they come to some of the digital symposiums, and they get to see other people and what they're doing, and they've learned lots of different skills along the way. And to upskill your team is to then give yourself more of a break from having to do everything. I know dentists find that very difficult because we're all a bit of the control freak, but actually if you get the right people involved and you get the right training, it's a no-brainer.
So the team is a big part of what we've done there.
Yeah.
And how do you feel this is, and the comments that you get from your patients in terms of their experience, their journey?
I mean, two of the most important things are, one, the fact they don't need an impression. They are just blown away by that.
Yeah.
But you don't need to put that goo in my mouth. You don't need to give me that horrible impression material. It's like, nope. And then the fact that they get it delivered on the day. But also the visual. So the visual aspect of seeing their own mouth on a screen is actually massively empowering. I think dentistry's been a black art for a long time, and people don't know what's going on inside their mouth. And actually, from an educational standpoint, it's amazing for them to be able to see what is actually in there. And they will buy more dentistry from you because they see old amalgams or broken down teeth, and they go, "Oh, that's horrible. Can I get that replaced?" And so you don't even have to sell anything. They want to buy it. So yeah, that's a shift, definitely.
And I know you've mentioned to me before regarding the education of patients, in terms of oral health, etc. How the impact of
I mean,
that?
now, especially, they've just brought out OraCheck with the new software with Prime Scan, and that's going to be a way of taking a full mouth scan and being able to then overlay the scan each year. So you can see tooth wear, you can see the gingival health, you can see, and I think one from a medical legal standpoint, and also from an educationally promotion to the patient and their oral hygiene investment. It's just superlative. You just can't beat it, really.
Yeah.
So.
And on some purely practical terms, when if I could ask you to cast your mind back, in terms of obviously making the decision between the units, but also then how financing, for example, what kind of considerations and plan did you put in place?
So I went on a gut instinct because that's kind of the way I roll. But actually, I've done a lot of maths on it since then to work out, to try and show other people that it is a good investment. And actually, if you do £4 a week and you do work for 40 weeks a year, in that first year, you'll make a saving on lab fees alone of £21,800, roughly, depending on the cost of your crowns. But what that would mean is you can pay the finance in that year just from the saving on lab fees alone. That's not even including the time that you save. It's not including the involvement of the patients and them buying more work from you. That's just purely on doing that minimal amount of work. So, and we've always just bought it on finance, and of course that's offset against tax. So it's a very effective way.
So the annual investment allowance as well.
Yeah. So it just has worked for us on many levels.
Yeah. Okay. Fantastic. And in terms of thinking of where you were going to put it in the practice, and where you've ended up, any lessons that you've learned from that side of it?
I mean, I think the thing for me is that I've just used it more and more, and I've got my team involved, including the other dentists. So we've now got an orthodontist who uses it for the orthodontic analysis. We've got our younger dentists who are doing it for all the restorative, and then I'm doing it for all implant work. So we are utilising that machine, or those various machines, because we've got a variety of them, but we're using them every single day, and it's really a power horse within the practice. And it's almost like it becomes a need. It started off that I just wanted it to try it out, and now it's definitely part of the furniture, and we couldn't live without it. So
you won't let us take it away from you?
Definitely not.
What's your next kind of purchase? Do you have anything in mind?
I do.
And kind of reasons why?
Yeah, I'm hoping to buy a printer next, because one of the things with the digital workflow at the moment is that I can only produce a guide in-house for one implant at a time, and it has to be milled. But with the opening of the STL files to make them accessible, we will be able to soon print out, and I would like to get an in-house printer, and there's some new ones on the market that are a bit simpler to use, because I've never invested in one, because they're all quite messy and it involves a lot of work, I think, to teach your team how to use that as well. So we're now going to look at, there's some new ones being produced. I can't tell you who yet. I've been sworn to secrecy. But that's coming on the market. So I hope to be able to use that.
So 3D printing?
3D printing, that's my next thing.
Okay, and in terms of you've mentioned before about other equipment in the practice. Could you just give us tell the audience an idea of the equipment that you have and the software that you use?
So we've got an Orthos 3D scanner. That's links into then being able to digitally plan the implant placement. We've got the software that goes with that that's been produced by Dentist by Sirona also. And then we've got an Omnicam. We've actually got a Blue Cam, an Omnicam and a Prime Scan. So, and then you need a milling unit. So we've got the milling unit and we've got an Ivoclar oven. So we've got quite a few bits of kit. But my long term, I may get another milling unit because it means we can do more units at the one time. So that's been one thing that kind of slows up progress if you're doing a full mouthpiece.
And what impact has this had on your laboratory work in terms and relationship with the laboratory?
I mean, I've got an amazing relationship with my laboratory because I'm doing big high-end work with them. So they're still very much involved. So I use Sirona Connect with them, and they do a lot of DSD planning with me and with my associate who's the orthodontist, and we plan cases together, and then we do mock-ups, and then they send stuff back, and basically we're working with them probably more than ever and more closely than ever. So
it's increased the work.
It's increased the sort of scope of their work. They're not just doing single units, they're doing multiple big stuff, which they like doing, which we can't really do in-house, and it's a win-win.
So you have a nice, an improved synergy.
We've got a great energy between us,
And how did you approach that with the lab? So there is some out there that this is taking workflow away from the laboratory. So
I think we were very lucky because I was involved with Steve Campbell, who's very into the digital workflow anyway, so it was kind of a marriage kind of properly, easily. I didn't have to persuade him. However, with the advent of the new Prime Scan, being able to give software without having to pay for it, because it used to be your lab had to have in-lab software, but you're now able to use that as a scanner and they will be able to get the software for nothing. So I think, and the other thing that's just come out is that only 1% of digital scans need a remake compared to 10% of the old-fashioned way. So as dentists, we need to think about that too. It's a massive saving of time and efficiency. And I don't think the labs should feel threatened.
So I'm hearing pick a laboratory that's digitally orientated and open communication.
Absolutely.
Sit down, what's the plan? This is what we're
work
looking
with
for.
them. Don't make them feel like you're sidelining them. You want to work with them and make it better.
And your experience of the outcome is that it's actually a better relationship
for everybody.
So if I was to, if we were going to impart some words of wisdom, both in terms of dental and patients, if I could ask you in maybe two lines for a dentist, what would that be about if I'm going to consider going digital dentistry? What would that be?
The most important thing from the dentist's point of view is to go and have play with all the toys to see what is going to work for you, and also have an idea of what it is you want to achieve with it before you buy it. But get on board and do it now. The time has never been better.
And from a patient's perspective, what would you, and I know you speak to hundreds and thousands of patients, you and your team, but how would you encapsulate that for a patient?
The patient wants to be involved in their own care, and they want to feel that they've got some choices, and they're better informed to make those choices if you show them a digital image of their mouth. It's just, it's black and white, or it's not black and white, it's colour, but it's basically, it's right there, and they can see and they can get involved with it, and they love it.
Okay, so thank you again.
No problem.
Eimear. And thank you for taking the time to chat today.
No problem.
And thank you to our viewers for tuning in, and we'll see you next time on Schein Chats.